Hello and welcome. Today we'll be discussing a common yet often unspoken health concern, bladder prolapse, also known as cystocele. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Bladder prolapse occurs when the supportive tissues and muscles that hold the bladder in place weaken and stretch. This allows the bladder to drop or descend into the vagina. Several factors can contribute to this weakening. Childbirth, particularly multiple vaginal deliveries or large babies, is a major cause. Pregnancy itself places significant strain on pelvic floor muscles. Other contributing factors include chronic coughing or straining, such as from constipation or chronic bronchitis, obesity, which adds extra pressure, menopause, due to decreased estrogen levels that weaken tissues, prior pelvic surgery, and genetics. In rare cases, certain connective tissue disorders can predispose individuals to prolapse. Normally, the bladder is supported by the pelvic floor muscles, ligaments, and fascia. These structures form a hammock-like support system. When these supports weaken or are damaged, the bladder loses its proper positioning. As the bladder sags into the vagina, it can create a bulge or pressure sensation. This prolapse can also obstruct the flow of urine from the bladder, leading to incomplete emptying and an increased risk of urinary tract infections. The severity of the prolapse dictates the extent of these symptoms and complications. Bladder prolapse is a fairly common condition, particularly in women who have had children. The exact prevalence is difficult to determine because many women are asymptomatic or too embarrassed to seek medical attention. However, studies suggest that a significant percentage of women experience some degree of pelvic organ prolapse, including cystocele, during their lifetime, with the risk increasing with age and parity as number of births. The symptoms of bladder prolapse can vary depending on the severity of the prolapse. Some women may experience no symptoms at all, especially in mild cases. However, common symptoms include a sensation of pressure or fullness in the vagina, a bulge protruding from the vaginal opening, difficulty emptying the bladder completely, frequent urinary tract infections, urinary incontinence, or leakage of urine, especially during activities like coughing, sneezing, or exercising. Some women may also experience pain or discomfort during sexual intercourse. Diagnosis of bladder prolapse typically involves a pelvic examination by a healthcare provider. During the exam, the doctor will visually inspect the vagina and surrounding tissues and may ask you to strain as if you are having a bowel movement to assess the degree of prolapse. A detailed medical history, including information about pregnancies, childbirth, and other medical conditions, is also crucial. Additional tests, such as a post-void residual urine test to measure how much urine remains in the bladder after urination, or a cystoscopy to visualize the inside of the bladder, may be performed to rule out other conditions or assess the impact of the prolapse on bladder function. Bladder prolapse is often classified into different grades or stages, ranging from mild to severe. Grade 1 prolapse involves a slight descent of the bladder into the vagina. Grade 2 indicates that the bladder has descended further, reaching the opening of the vagina. Grade 3 signifies that the bladder protrudes outside the vaginal opening. And Grade 4, also known as complete prolapse, is when the entire bladder is outside the vagina. The classification helps determine the appropriate course of treatment. Treatment for bladder prolapse depends on the severity of the prolapse and the individual's symptoms. For mild cases, conservative management options may be recommended, such as pelvic floor exercises, also known as Kegel exercises, to strengthen the supporting muscles. A vaginal pessary, a removable device inserted into the vagina to support the bladder, may also be used. For more severe cases or when conservative measures are ineffective, surgical options may be considered. Surgery aims to repair the weakened tissues and restore the bladder to its normal position. Different surgical approaches are available, including vaginal and abdominal approaches, and may involve using the patient's own tissues or synthetic mesh to provide additional support. While it's not always possible to prevent bladder prolapse entirely, there are steps you can take to reduce your risk. Performing regular pelvic floor exercises, maintaining a healthy weight, avoiding chronic constipation and straining during bowel movements, and properly managing chronic coughs can all help strengthen the pelvic floor muscles and reduce the pressure on the bladder. Women who have had children may also benefit from postpartum pelvic floor rehabilitation programs. The prognosis for bladder prolapse is generally good. Many women experience significant improvement in their symptoms with conservative or surgical treatment. However, it's important to understand that prolapse can recur, particularly after subsequent pregnancies or with continued straining. Ongoing research focuses on improving surgical techniques and developing new materials for pelvic floor support. Recent studies are also exploring the role of regenerative medicine in repairing damaged pelvic tissues. These advancements hold promise for more effective and long-lasting solutions for bladder prolapse.